Thank you, Mr. Moderator, for giving me the floor. And I would like to thank the organizer for giving us the opportunity to present this work that we conducted in Cameroon to assess the effect of TB prevention treatment on TB incidence and non-TB related mortality. Next slide. Oh. Okay. We have nothing to declare. Just to remind what we all know, TB is the major opportunistic disease among people living with HIV, and of course, the major AIDS-related cause of death. And especially among children below 15 years old, in 2023, WHO reported estimated 21,000 TB-related deaths occurring in this population. The reason of this important number of deaths is that children below 15 are 8 to 20 times more likely to develop TB disease than those not living with HIV. And to avoid all these diseases and mortality, evidence has shown that TB preventive therapy, be it long course 6 months INH or short course with 3 RH or 3 HP, are effective in reducing mortality and the disease. However, despite the routinely distribution of initiation of TPT when initiating ART, we still notice important mortality in our children's cohort. This is why we decided to conduct this analysis to assess the effect of TPT on TB incidence and also look at non-TB related mortality and estimate the TB-free survival among children and adolescents living with HIV in Cameroon. To meet this goal, we conducted a retrospective cohort analysis, using routinely collected data of children and adolescents living with HIV, age 0-19, initiated on ART between October 2020 and September 2022 in 72 PEPFAR-supported health facilities in Littoral and South region, the highest HIV prevalence region in the country. And it's important to note that during this period, October 2020 to September 2022, 6 month INH was the available TPT for all the children. So to conduct this analysis, we abstracted data from the HIV management clinical database, which reflect all the data available in the HIV registers and in the patient medical file. We were specifically looking at data on demographic and ART initiation, TPT initiation and adherence, and of course, TB and death data outcomes. For the TPT, we defined the TPT uptakes as 3 categories. Those who initiated and completed TPT that we label TPT completers. Those who initiated and did not complete TPT, who were TPT non-completers, and those who never initiated TPT, that we label TPT non-initiators. Our primary outcome, as I said, was TB incidence and non-TB related mortality, which means mortality from all causes excluded TB. During the statistical analysis, we considered the time at risk for incidence and mortality starting 3 months following ART initiation. This was to exclude the prevalent TB misdiagnosed during ART initiation for the same reason that the previous presenter just mentioned. And we used the Poisson regression model to estimate the incidence and the Kaplan-Meier to estimate the TB-free survival. So what did we report? I know the font size is a bit smaller, but in terms of demographic, during the 2 years period, 1,079 children and adolescents were initiated on ART. among which 42% were age 0-9 and 63% were female. In terms of TPT uptake categories, 46% initiated and completed TPT, 38% initiated but did not complete TPT, and 15% did not initiate TPT at all. And we can see the disaggregation per age, sex, and region there. During this period, we have 11 incident TB cases and 59 TB deaths, and I will go further on this now. The TB incidence overall was 7.1 cases per 1,000 person-year observation, but we can see on this table that among TPT completers, the incidence was lower compared to TPT non-completers and TPT non-initiators. It is true that, interestingly, we have a bit more TB cases among TPT non-initiator than, low TB cases among TPT non-initiator than TPT non-completers, but we have our idea on that. Looking at non-TB related death, we can see that the incidence of death was 23 deaths per 1,000 person-year observation, and it was significantly lower among the completers compared to the non-completers, and really high among the TPT non-initiators. And when we perform the TB-free survival analysis, we can see that the probability of remaining alive and without TB was significantly higher among those who initiated and completed TPT compared to those who never initiated, and also to those who initiated and did not complete TPT. So what are the key messages? First of all, after a median follow-up duration of 21 months, the TB incidence was lower among the completers compared to the non-initiators and the non-completers, which is expected. But what is interesting is that the deaths not reported as TB deaths were also lower among TPT completers compared to the non-completers and the non-initiators. And also the TB-free survival was, probability was higher among the TPT completers. What does this mean? It means that it is critical for all the HIV program to emphasize on the systematic screening, being it symptom screening or using additional method or what our previous presenter just shown, like sputum and tools. But it's important to diagnose or eliminate TB at the time of ART initiation, to initiate TPT to all the children and make sure that they effectively complete the TPT so that we can expect a longer TB-free, a higher TB-free survival probability. I will end my presentation by thanking the facility staff, the patient who agree that we use the data, and all the institutional partners, CDC, PEPFAR, Elizabeth Glaser, and of course the Cameroonian MOH. Thank you.